Welcome to Module 1 of Comm 3693, Interpersonal Health Communication. For today's video, we're going to cover some broad-based information about this somewhat nebulous topic of interpersonal health communication. In the video, we're going to cover what interpersonal health communication is and the context to which it applies. So at the outset of this course, you may be asking yourself, what is interpersonal health communication and how does it differ from just health communication? In this class, we're trying to marry the principles of health communication theories with interpersonal communication theories. Let's start off with a dictionary definition of interpersonal health communication, and I'll point out a few important things within it. Interpersonal health communication is reasoned, goal-oriented dyadic interactions about anything related to health behaviors. From its outset, you can probably already tell that a lot of behaviors we engage in on a daily basis fall into interpersonal health communication. Here are a few things I wanted to highlight from the definition. The first is that interpersonal health communication is often goal-directed. This means we rarely talk about health with others in an automatic or habituated manner. Instead, we have an objective in mind when we talk about health with others. The second is that it involves dyadic communication. This means interpersonal health communication involves the communication between two people. So, for instance, we won't be covering self-help groups or communication health campaigns because those involve larger group communication or even mass communication. Finally, the interactions must be related to health in some form. This could mean conversations about sex with your romantic partner, how to best handle end-of-life care with your son or daughter, or how to best manage the symptoms of a cold with one's primary health care physician. In the previous slide, I talked about interpersonal health communication being goal-oriented. So let's explore these goals in a little bit more detail. In interpersonal communication, there can be several different types of goals we develop. Drawing on a typology developed from Clark and Delia in 1979, the main communication goals are instrumental objectives, interpersonal objectives, and identity objectives. Let's first look at instrumental objectives through the lens of interpersonal health communication. Instrumental objectives look at the purposeful task of the communication situation. This means that if your goal is for you to convince your friend to stop smoking, it's instrumental in that the task is the focus of the communication. The next is interpersonal objectives, where the goal of the communication involves the establishment or maintenance of a relationship with others. So if you're talking with your partner about how your recent communication with them has affected your mental health and by extension your relational satisfaction with them, the main goal would be considered an interpersonal objective. Lastly, identity objectives involve a communication situation wherein presenting a desired self-image for the speaker or creating or maintaining a particular sense of self for others is emphasized. So for instance, if you're trying to present yourself to a friend that you're into fitness and concerned about diet and exercise, This might be considered an identity objective in interpersonal health communication. One last thing to note about these goals is that they're not mutually exclusive in communication and often occur in tandem. In the example I mentioned before, you might be persuading a friend to stop smoking not only because it's bad for their health, but in addition, you don't want that desired and valued friendship to end. You can probably already tell now that there are many communication contexts we engage in on a daily basis that involves health broadly defined. Here are some illustrative examples of how interpersonal health communication plays a role in our daily lives. Suppose you lost a considerable amount of weight and wanted to talk about life adjustments in an online support group with other people. Perhaps you want to discuss a new blood pressure medication you saw an ad for on TV with your doctor. It could also involve talks with your parents about how they wish to manage their care when they become elderly. Or it could be as simple as gym buddies talking about what workout regimen or protein shake they like the most. It could also involve friends talking about the appropriateness of contraceptives in their life. Or interpersonal health communication can even involve doctors talking to other physicians about their mutual patient's healthcare plan. There are two broad-based modes of care that can be affected by interpersonal health communication with friends, family members, or healthcare professionals. The first is palliative care, and the second is preventive care. Both of these principles might be reviewed for you in other classes you may have already taken in health communication. So let's dive into the differences of palliative care and preventive care and think about where interpersonal health communication fits into these different modes of care. Palliative care is marked by improving the quality of life of patients and their families who are facing challenges associated with an illness. Those challenges could involve both visible or hidden medical conditions. Preventive care, on the other hand, is aimed at improving the quality of life of individuals by encouraging to engage in healthy life behaviors that may prevent health challenges from occurring. From these previous definitions, then, you might have already guessed that palliative care occurs after a medical professional diagnoses someone with an illness. These illnesses can be curable, or in some instances, incurable. Preventive care occurs before a medical illness is diagnosed. According to the World Health Organization, an estimated 56.8 million people in the world are in need of life-threatening palliative care, but only 14% of those who need it are currently receiving it. According to some other estimates, nearly 40% of all deaths in the US are due to behavioral causes which could have been prevented. Services like tobacco screening alone can save about $5 billion annually for the healthcare system. There are different models of how people within a nation are cared for as it relates to their health. The first is universal coverage with a single payer system. You might have also heard of this referred to as socialized medicine. This is a healthcare plan that is fully funded and delivered publicly by the government. Nations like Britain, Spain, Cuba, and New Zealand have adopted this form of healthcare. The second is universal coverage with a multi-payer system. In this national health insurance plan, healthcare is publicly funded and privately delivered with multiple insurers. Also, private healthcare options are available for those who can afford them. Places like Taiwan, Canada, and South Korea use universal coverage with multi-payer systems. In a multi-payer system with no universal coverage, healthcare is funded by employers and employees with options available for those uninsured individuals in the system. Finally, the fully out-of-pocket plan is for individuals who pay for their own care. This occurs in rural areas of India, Africa, South America, and China. That's pretty much all I have for this introductory module on what this area of interpersonal health communication involves. In this module, you learned about the different components that make up the definition of interpersonal health communication. We reviewed different broad goals of communication, which I hope you can use and further apply to interpersonal health communication. We then discussed the differences between care types and models of health, which will form the backbone for further discussions on the influence of interpersonal communication in health-related outcomes. As usual, if you have any questions, please drop them in the comments of this video or feel free to email me. Thank you very much, and I hope you have a great rest of your week.